Dr. Sahara Okad here. So I wanted to talk to you today about weight loss because I know that's a massive issue for lots of men and women out there. And I wanted to talk to you about different ways of approaching this. Now, of course, the foundation to weight loss is good, healthy diet, looking at whole foods, and also exercise, of course. And there is an element of calories in and calories out. Yes, for sure, we cannot deny that. But there are other factors that can affect your weight as well. So this isn't about the whole basic weight loss thing. This is if you're trying those things, but you're still not having good results. So some of the things I look at with my patients is, are they getting insulin resistance? So this is when you're not a diabetic, but your body's producing a lot of the insulin hormone to keep your sugars normal. And insulin is a very inflammatory hormone, so it will cause you actually not to lose weight, but to store fat. So that's something I look at with my patients. And this can be modified with supplements or medications like metformin if we feel that that's necessary. I also look at things like the thyroid to make sure there's not a hormonal issue in terms of not being able to lose weight. And the hormones like testosterone and DHEA can sometimes improve your metabolism also. For some of my patients, having a good whole food diet is not enough. And firstly, for women having cycles, I just want to emphasize that sometimes our cortisol gets pushed up if we're not eating for the right way throughout our cycle. So what that means is that some women follow very restrictive diets all the way through the month. And this isn't great for your cortisol. And if the cortisol's high, like insulin, it actually causes you to become inflamed and store fat. And in fact, the high cortisol can cause a high insulin. So the two kind of go hand in hand. So cortisol, again, is very important in terms of weight loss because if you're very, very stressed out or burnout, it can sometimes be hard to lose weight. In terms of regulating the cortisol, I can't keep telling you about ashwagandha all the time, but I always do. For the insulin, supplements like berberine can really help as well to help regulate that insulin. So in terms of diet, yes, like I was saying, you don't always need to eat the same diet throughout the month. You need a good level of fat to help produce our hormones. And we do need some carbohydrates before our period because progesterone needs that to be produced correctly and to help regulate our periods. But in the middle 2 weeks of the month, that's when we can do our HIIT exercise and we can do a more restrictive diet with less carbs and more protein and salad sort of way of eating. So it's good to remember that so we're not putting too much strain on our bodies and inadvertently causing inflammation and affecting our weight loss. There are medications on the market for weight loss. The licensed injection is called Saxenda or liraglutide, and that medication is a daily injection that helps to suppress the hunger hormone, and also the hormone for appetite also, so you feel full quicker, and this has great results. And there's also an unlicensed hormone called Ozempic or semaglutide, which also has really good results. And that's a weekly injection. It's approved for use in the US and other parts of the world, but it's still going through the process in the UK, but it can be used in an unlicensed form. And this can really kickstart your weight loss by helping to regulate that appetite, helping you to make better food choices as well. Hey, look, it doesn't work so well if you're still wanting to eat pizza every night and burgers and chips. But if you're following a good diet and you're exercising, I've seen it have amazing results on patients I've treated. It really, really does. So these are options, and it can be combined with intermittent fasting. It can be combined with your exercise regime and a whole food diet. All these things are really important as well. There's lots of benefits to intermittent fasting. It helps the process called autophagy. I think it's autophagy. And that is a really great process for helping to remove disease cells from your body and give your body a detox basically. And that happens at about 14 hours of not eating. So that's really good. And it helps improve this insulin resistance too. So if that's an issue for you, some intermittent fasting can be helpful. I've seen patients though who can't tolerate fasting, so it's not for everyone, but just for you to know it can be an option. So I think I've given you a bit of information on weight loss there. It's good to know that one size doesn't fit all, but if you are doing healthy eating and exercise or some intermittent fasting and you're not having results, perhaps we need to check your insulin, perhaps we need to see what your cortisol's doing, and perhaps we need to consider a weight loss medication also. So it's just for you to know that there are more options out there if you're feeling really stuck with your weight loss. So good to speak to you today, and speak again soon. Bye.